Hearing loss is a hidden disability. Hearing is a complex process, so it should be no surprise that the causes of hearing loss are also complex. In the upcoming modules, we will cover types of hearing losses, the anatomy of the ear, and we'll explore the educational impact of hearing loss on children. We will begin with information on the anatomy of the ear and how the ear functions to deliver sound to the brain. Problems with hearing and listening can occur at any point along the hearing pathway. Problems in different anatomical structures or locations will cause different types of hearing loss and listening difficulties. The way a person who is deaf or hard of hearing identifies themselves goes beyond a medical diagnosis. There are several labels people use to identify themselves. Deaf and hard of hearing people refer to themselves as being deaf with a capital D or big D, deaf with a little d, or hard of hearing based on their sense of belonging to the deaf community in addition to their degree of hearing loss. The different terms on this slide reflect differing views of deafness. The preferred terms are deaf and hard of hearing. Some professionals use the term hearing impaired to identify a child with a hearing loss. This is a medical or clinical term that implies a need to fix or change. Within the deaf community, people don't consider themselves as impaired. Members of the deaf community and hearing professionals who share this view use the terms deaf and hard of hearing. Individuals who are deaf or hard of hearing may have individual preferences. Their choices to use one term or the other may be based on many factors, including communication and culture. I've mentioned the deaf community a few times already. What is the deaf community? A community is a group of people who share common interests and a common heritage. The deaf community is comprised of individuals, both deaf and hearing, who to varying degrees embrace particular community goals that come from deaf cultural influences. A culture is generally defined as a system of values, beliefs, and standards that guide a person's thoughts, feelings, and behaviors. Capital D deaf individuals are typically those who have severe to profound hearing loss. People who belong to this group have a strong sense of belonging within the deaf community and tend to communicate using American Sign Language, not oral methods such as spoken English. The second category is that of lower D deaf individuals. The people belonging to this group also tend to have a severe to profound hearing loss, but do not feel a strong sense of belonging to the deaf community or culture. They may communicate via sign language, written, or spoken English. These people tend to view themselves as medically deaf. The third category is that of persons who are hard of hearing. Hard of hearing individuals tend to have a mild or moderate hearing loss. Individuals belonging to this group tend to communicate using spoken and written language, with little interest in becoming fluent in a signed form of communication. Sometimes the individuals from this group feel a strong sense of belonging to the deaf community, and sometimes they identify more with the hearing community. Yet often, these individuals do have a strong sense of belonging to either the deaf or the hearing community. How one refers to a deaf and hard of hearing student should depend on that child's preference. Some deaf and hard of hearing people prefer the term deaf, while others prefer the term hard of hearing. Although the degree of hearing loss is often a factor, it cannot be the only one that's considered. The labels of deaf and hard of hearing people go beyond the medical diagnosis, and they are significant to one's sense of belonging to the deaf community. Let's do an activity to test your hearing skills. Take the following spelling test to hear how some words sound for individuals with a hearing loss. This is a very familiar exercise in the deaf community known as the unfair spelling test. The words that are included were chosen because they're words that had the potential to sound like other words. I bet that you can't get them all. Grab a pencil and a piece of paper if you don't have one handy, and number 1 through 10.
This is an unfair hearing test. The words have been carefully chosen so that they are easily confused with other words which sound much the same, and we have rigged the test to prove a point. You will hear the list of words 3 times. First, filtered as though you had a slight high-frequency hearing loss. People with this degree of impairment often do not even realize they have a loss. In fact, they get very indignant when their friends suggest that they may have a hearing problem. At other times, they are very frustrated because they think everyone is mumbling, even when they're not. We will also speak just a little softly, so you will have to concentrate hard on hearing the words correctly. You are to write them down. We think you're going to have a little problem getting them 100% right. Remember, we are giving you a little hearing loss as you listen to the test. Go ahead, try it. Write the words in column A on the worksheet. Here's the list. Ready?
Number 1, fill. Number 2, catch. Number 3, thumb. Number 4, heap. Number 5, wise. Number 6, wedge. Number 7, fish. Number 8, shows. Number 9, bed. Number 10, juice.
Now we will repeat the list without eliminating any of the high or low frequencies, just as though you had normal hearing. But again, just a little softly, so it isn't too easy for you. This time, use column B to write them down.
Number 1, fill. Number 2, catch. Number 3, thumb. Number 4, heap. Number 5, wise. Number 6, wedge. Number 7, fish. Number 8, shows. Number 9, bed. Number 10, juice.
Was that better? Good. I'm still not willing to bet that you got them all right. There are some tricky words on the list. Now comes the interesting part. This time, instead of filtering out the high frequencies, we are going to put in a little more of them. It will sound as though you are wearing a hearing aid which is compensating for your hearing loss by giving extra emphasis to the frequencies that you don't hear so well. Try it once again. This time, write the words in column C.
Number 1, fill. Number 2, catch. Number 3, thumb. Number 4, heap. Number 5, wise. Number 6, wedge. Number 7, fish. Number 8, shows. Number 9, bed. Number 10, juice.
Now, if your hearing is normal, you should have done as well on column B as on column C. But even with reasonably normal hearing, the third reading, with a little high-frequency emphasis, probably sounded a little more distinct than the normal reading of List B. We said it was an unfair hearing test. Did List C sound a lot sharper? If it did, you may have enough of a hearing loss to want a professional hearing test. It is now time to turn the record over. You might want to take a little break and check the words on your list against the correct words printed on the back of the record jacket.
How did you do? Hearing loss is invisible, but experiencing the challenge of listening, even with minimal or a mild hearing loss, can make a lasting impression. To best understand hearing loss, it's helpful first to understand the anatomy of an ear. The ear has three main parts: the outer ear, the middle ear, and the inner ear. The anatomy of the ear can be a little confusing, especially since the ear is responsible not only for hearing, but also for balance. The outer ear is composed of the pinna, or the earlobe, and the external auditory canal. Both structures funnel sound waves towards the eardrum or the tympanic membrane, allowing it to vibrate. The pinna is also responsible for protecting the eardrum from damage. Modified sweat glands in the ear canal form earwax. The middle ear is an air-filled space located in the temporal bone of the skull. Air pressure is equalized in this space via the eustachian tube, which drains into the nasopharynx, or the back of the throat and nose. There are three small bones, or ossicles, that are located adjacent to the tympanic membrane. The malleus, incus, and stapes are attached like a chain to the tympanic membrane and convert sound waves that vibrate to the membrane into mechanical vibrations of the three bones. The stapes fills the oval window, which is the connection to the inner ear. The inner ear has two functions. The first is hearing, and the second is balance. It is a warren of tubes filled with fluid encased within the temporal bone of the skull. The bony tubes also contain a set of cell membrane-lined tubes. This is where the cells responsible for hearing are located, the hairy cells of Corti. The bony labyrinth itself has three sections. The first, which is the cochlea, and it is responsible for hearing. Second, the semicircular canals, which have functions associated with balance. And third, the vestibule, which connects the two and contains two more balance and equilibrium related structures, the saccule and the utricle. The final structures of the inner ear are the round window and the eighth cranial nerve, which is composed of the vestibular nerve for balance and the cochlear or hearing nerve. Let's watch a clip on how the ear works.
Ears are constantly active. They pick up sound waves and change them into information that the brain can interpret, such as music or speech. Sound is a pressure wave that can vibrate either quickly or slowly. Slow vibrations produce deep sounds, while quick vibrations produce high-pitched sounds. Sound enters the ear and is directed through the ear canal, where it first reaches the eardrum. As the eardrum begins to vibrate, it sets the ossicular chain in motion. The ossicular chain consists of the hammer, anvil, and the stirrup. Sound vibrations move along the ossicular chain and into the inner ear. Within the inner ear, the cochlea plays a central role. It is here that the mechanical energy of sound is converted into complex electrical signals, which are then passed on to the brain. In simplified terms, the cochlea is a spiral-shaped tube filled with fluid. Sensory cells, also called hair cells, line the entire length of the cochlea. These hair cells have varying degrees of sensitivity for the detection of different tones or frequencies. This allows the ear to perceive the entire spectrum of sound. The change from mechanical vibration to electrical pulse is a complex process resulting from the movement of hair cells in the cochlea. Along the entire length of the cochlea, the hair cells are arranged like the keys of a piano. Hair cells located at the base or lower region of the cochlea are responsible for high frequency, while hair cells at the apex are responsible for the low frequencies. As the fluid in the cochlea is set in motion, it causes a corresponding movement of the fine structures on the surface of the hair cells to take place. These movements cause tension differences which produce electrical signals that are passed along the hearing nerve to the brain. The auditory cortex of the brain interprets this information as sound, for example, as music or speech. The entire chain of events, including the various steps that convert sound waves from the environment into information that the brain can interpret, happens so fast that individuals can hear sound both continuously and instantaneously. Within this complex chain of events, there are a number of factors which can cause an individual to experience hearing loss. A loss of hearing can range from a mild to moderate hearing deficiency to a total hearing loss. In general, there are three main types of hearing loss which differ from one another depending on the part of the ear that is affected, be it the outer, middle, or inner ear.
In order to understand the deaf or hard of hearing students within the classroom, it's important to know about the different types of hearing loss and which type of hearing loss your deaf or hard of hearing child may have. The first type of hearing loss we're going to talk about is called a conductive hearing loss. A conductive hearing loss is one that occurs in the outer or middle ear. These can be temporary things such as an ear infection, wax buildup, or water in the ear. There can also be more permanent forms of conductive hearing loss that cannot be treated. A sensorineural hearing loss is another type of hearing loss. A sensorineural loss is the type of hearing loss that occurs within the inner ear or with the acoustic nerve. A mixed hearing loss occurs when a child has a sensorineural and conductive hearing loss within the same ear. It is possible for a child to have a sensorineural loss in one ear and a conductive loss in the other ear. However, this does not qualify as a mixed loss as the two types are not co-occurring within the same ear. The fourth type of hearing loss that we're going to cover today is called auditory neuropathy. When a child has auditory neuropathy, the hair cells, cochlea, and all other parts of the ear seem to be working properly, but the sound information is not transferred through the air and ear into the brain accurately. Somewhere along the path, a breakdown occurs and the message is lost or jumbled. The following video does a phenomenal job describing the different types of hearing loss.
A conductive hearing loss is a problem in the outer or middle ear that prevents sound from reaching the inner ear. For example, a blockage or deformity in the middle ear can prevent the ossicles from vibrating properly. Middle ear infections or a ruptured eardrum are common causes of a conductive hearing loss. Often, a conductive hearing loss is temporary and can be treated with medication or surgery. When the hearing loss cannot be treated medically or surgically, the result is a permanent conductive hearing loss. In these cases, many people benefit from middle ear implants or conventional hearing aids.
A conductive hearing loss can often be corrected medically or surgically. Making sounds louder helps, so a conductive loss can be helped by the use of hearing aids since they make sound louder. We'll talk about causes of hearing loss in a moment, but one type of conductive hearing loss can be caused by chronic ear infections. A chronic ear infection is a buildup of fluid behind the eardrum in the middle ear space. Most ear infections are managed with medication or careful monitoring. Infections that don't go away with medication can be treated with a simple surgery that involves putting a tiny tube into the eardrum to drain the fluid out. Another type of conductive hearing loss is caused by a part of the outer or middle ear that did not form correctly while the baby was growing in the mother's womb. There are several parts of the outer and middle ear that need to work together to send sound to the inner ear. If any of these parts did not form correctly, there might be a hearing loss in that ear. The problem may be improved and perhaps even corrected, again with surgery. As with the two examples we just talked about, conductive hearing loss is caused by any blockage that prevents sound reaching the inner ear. Some of the causes of conductive hearing loss include a buildup of earwax and middle ear infections, known as otitis media, which we just discussed, otitis externa, often referred to as swimmer's ear, which is an infection of the ear canal, most likely related to water exposure. Although the most common symptoms of otitis externa are pain and tenderness of the ear, conductive hearing loss can also occur if there is severe swelling of the ear canal. Otosclerosis is an inherited disease in which the bone around the stapes bone hardens and the stapes fails to vibrate effectively. The conductive hearing loss slowly progresses in early adulthood. It affects women more often than men and affects slightly less than 1% of the population overall. This condition may be treated with a hearing aid or with a stapedectomy surgery, which is highly effective in restoring hearing in most cases. Another cause of a conductive hearing loss is poor eustachian tube function, which may result in excessive negative pressure behind the eardrum, causing the eardrum to collapse into the middle ear bones. Severe retraction of the eardrum may necessitate ear tube surgery or a surgery to rebuild the eardrum. A perforated eardrum is a hole in the ear due to infections or trauma and may result in hearing loss as the sound vibrations are not effectively captured by the damaged eardrum. Complete malformation of the external ear canal is called atresia. It may be seen along with complete or partial malformation of the pinna or the outer ear and is noted at birth. It is rarely associated with other congenital abnormalities and is most often only one side, so unilateral. Management of congenital oral atresia is complex. Surgical treatment may be beneficial to either reconstruct the ear canal in select cases or to implant a device that vibrates the bone of the ear directly.
A sensorineural hearing loss is the result of a problem in the inner ear. Sensorineural hearing loss occurs when hair cells in the cochlea are missing or damaged. These hair cells are responsible for producing precise electrical signals that the brain needs in order to interpret sound. When these hair cells are missing, the result is hearing impairment. When only some of the hair cells are missing, the hearing loss is classified as mild to moderate. In these cases, a middle ear implant, capable of vibrating the moving structures of the inner ear, or a conventional hearing aid may be a viable solution. Some individuals have a hearing loss only in the high frequencies, also referred to as partial deafness. In these cases, only the hair cells at the base of the cochlea are damaged. In the inner part of the cochlea, the apex, the hair cells which are responsible for processing the low tones are still intact. Combined electric and acoustic stimulation, or EAS, was developed specifically for these individuals to maximize the use of their natural residual hearing. When the hair cells of the cochlea are completely absent or damaged, the person suffers from a severe to profound hearing loss. For many individuals with this condition, a cochlear implant may be the best solution.
With a sensorineural hearing loss, sound is distorted, often resulting in an inability to understand what is being said. Sound getting louder doesn't help, and it is not often medically or surgically treatable. Sensorineural hearing loss is often a result of the aging process. The inner ear nerves and sensory cells gradually die, so it's a permanent condition. The causes of sensorineural hearing loss are varied but can be generally put into two categories: congenital or acquired. Congenital hearing loss is present at birth and is the most common problem seen in newborn babies. It can be either inherited or caused by an abnormal development in the fetal stages of life. Before the development of a vaccine, maternal rubella or German measles was a common cause of congenital hearing loss. Acquired hearing loss, which happens after birth, can be caused by a wide range of factors. These include noise exposure from machinery or firearms, Meniere's disease, and meningitis. Ototoxic drugs, which damage the ear but may be necessary to treat some life-threatening medical conditions, can also trigger hearing loss. Trauma to the head is another cause of hearing loss.
A mixed hearing loss is a combination of sensorineural and conductive hearing losses. Mixed hearing loss results from problems in the outer or middle ear, as well as the inner ear. Treatment options for this type of hearing loss include medication, surgery, hearing aids, or middle ear implants. Your doctor will help you choose the solution best suited to your individual needs.
In addition to the types of hearing loss, one's loss of hearing can occur either unilaterally or bilaterally. Unilaterally means that the loss occurs in one ear. Bilaterally means that the loss occurs in both ears. Genes are responsible for hearing loss among about 50% of children. About 20% of babies with genetic hearing loss also have a syndrome, for example, Down syndrome. Non-genetic factors such as infections during pregnancy in the mother, other environmental causes, and complications after birth are responsible for hearing loss in about 25% of babies with hearing loss. That leaves an additional 25% to unknown causes. Nearly 1/4 of children with hearing loss has one or more other developmental disabilities, such as cerebral palsy, an intellectual or cognitive disability, or vision loss. The job of an audiologist is to identify and determine the possible problems that a hearing loss might create. Their role extends to recommending hearing technology and habilitative or rehabilitative interventions that allow the child to reach his or her maximum potential. For a child with a hearing loss, they are key members of the educational team. The hearing system can be tested at any age. A variety of tests are available to identify and define the degree and type of hearing loss that a child may be experiencing. A threshold is the level of intensity or loudness where a person is able to detect the presence of sound. The sound at this level is so soft for the person who is listening that they would miss it 1 out of 3 times that it's presented. The audiologist tries to find the thresholds for each ear along a range of low to high pitch tones. In addition to measuring the person's ability to detect these different frequencies in both ears, the audiologist will usually measure the person's ability to understand speech in quiet and sometimes in the presence of background noise. The audiogram shows the frequencies or pitch across the top from low to high, much like a piano keyboard. The side axis is the intensity or loudness of the sound in decibels. Sounds at -10 decibels are very soft, even for someone with normal hearing. Sounds at 90 decibels and above are uncomfortably loud for most individuals who have normal hearing. Typical conversational speech ranges in the area of 25 to 55 decibels. Responses to sounds are recorded on the audiogram chart at the threshold of hearing for each frequency. The right ear responses are recorded as a circle and the left ear responses as an X. For an adult listener, thresholds are normal if they are recorded at 20 decibels or softer for all of the frequencies that are tested. A child's responses should be at or softer than 15 decibels to be considered normal. This audiogram indicates hearing within normal limits for both ears at all frequencies. So there are also varying degrees of hearing loss. There is the normal range, the mild range, the moderate range, the severe range, and the profound range. Sometimes a child's hearing loss may be referred to as a combination of the two ranges, such as mild moderate or severe profound. Depending on where the child's loss falls within this range will impact what educational needs they will have and how to address them. In general, the more severe of a loss, the more services that are needed in regards to educational programming and speech-language development. This audiogram again shows the different frequencies or pitches in hertz and the loudness or intensity of the sound on the side, from soft, that you wouldn't be able to hear, so the -10 decibels, to very, very loud and could hurt your ears, 120 decibels all the way down at the bottom. Familiar everyday sounds are noted in the picture's representation. For example, the sound of water running from a typical household faucet are made up of primarily low-frequency sound waves that occur at a typical intensity or loudness level of 10 to 20 decibels. In contrast, a bird's tweeting is usually very high in frequency or pitch, but is of similar loudness. The sounds of a jet engine are high in frequency, like a bird, but are very, very intense or loud. That's why airline baggers and maintenance workers wear earplugs and ear muffs for protection. The shared area indicates the loudness level and frequency area of human speech. As you can see, it covers a range from soft to medium sounds and low to high frequency sounds. So the yellow part is called the speech banana, and this is where speech is heard. And you can see that certain sounds, like the M and the U, are lower frequency sounds, and sounds like the H, the F, and the S are higher frequency sounds. So listen to them for just a second. Oo, s. Do you see how it makes sense that the and the U are lower frequency sounds, and the H, and the S, and the F, are higher frequency sounds? So if students have hearing loss in the lower frequencies, they're going to miss the M's and the U's. If they have hearing loss in the higher frequencies, they're going to miss the H's, F's, and S's. Now here's a little quiz for you. You see two audiograms here. One is audiogram A and the other is audiogram B. Which child has normal hearing, and which child would be considered to be deaf and hard of hearing based on the results of this audiogram? We'll assume that the hearing is exactly the same in both ears. Does audiogram A show normal hearing, or does audiogram B show normal hearing? And which audiogram shows evidence of a hearing loss? What do you think? If your answer to that question is audiogram B, you're exactly right. You see that it's indicated that the child has a hearing loss of 30 or more across all of the first several frequencies. And then when you get to the higher frequencies, the loss becomes quite severe and goes all the way up to 60, where audiogram A is just straight reading at 0. So that child with audiogram A has normal hearing. Let's talk about other difficulties associated with hearing loss when it occurs in children, especially younger children. Older children or adults who acquire hearing loss at a later age, after the development of speech and language, are impacted by the inability to hear or understand what is spoken to them. However, if they know the context of the conversation and key words or phrases, they're able to use language that they have to fill in the gaps of the conversation. For example, if I told you that the following sentence was about a picnic,